Ever feel dizzy when standing up? Constantly tired for no reason? Experiencing cold hands and feet even when it's warm? You might think low blood pressure is harmless, but what if it's actually a warning sign of something deeper? Today, we'll uncover why it happens, what it means, and how to fix it. Welcome to Levitas. Low blood pressure, what is it? Low blood pressure, also known as hypotension, occurs when blood flow isn't strong enough to deliver oxygen and nutrients efficiently to the body. This means the brain, heart, and organs aren't getting what they need, leading to symptoms like dizziness, fainting, blurry vision, and fatigue. A normal blood pressure reading is around 120 to 80 mercury millimeters, but when it drops below 90 to 60 mercury millimeters, it's considered hypotension. Unlike high blood pressure, which can damage arteries over time, low blood pressure can cause sudden, dangerous symptoms. But what causes it? Let's start with one of the most common reasons: pregnancy. Why does pregnancy cause low blood pressure? Pregnancy is a major trigger for low blood pressure. Why is this? Because during pregnancy, the blood vessels expand to support increased circulation, causing a temporary drop in blood pressure. This is most common in the first and second trimesters and can lead to dizziness, fainting, and extreme fatigue. How can this issue be fixed? First, stay hydrated, since dehydration worsens low blood pressure, so pregnant women should increase fluid intake. Eat small, frequent meals, since large meals can shift blood flow away from the brain, making symptoms worse. But remember to make this healthy food-based meals. Avoid sudden position changes. This is because standing up too fast can cause dizziness and fainting. Compression stockings can help, since these prevent blood from pooling in the legs, improving circulation. Blood pressure usually returns to normal after delivery, but monitoring is key to avoid complications. How can heart and heart valve conditions cause low blood pressure? Your heart is a pump, and if it's weak, damaged, or not working properly, blood pressure drops. Conditions like heart failure, valve disorders, and arrhythmias can lead to poor circulation, causing symptoms like chronic fatigue, shortness of breath, and cold extremities. Can you fix these issues? Medications might help. Doctors may prescribe drugs to improve heart function and regulate rhythm. Dietary changes, like a heart-healthy diet rich in omega-3s, potassium, and magnesium, helps maintain stable blood pressure. Regular exercise is a powerful tool. Low-impact activities like walking and swimming strengthen the heart. Salt intake adjustment can be key. Unlike hypertension, a little more salt can sometimes help raise blood pressure. If the cause is a valve disorder, surgical procedures like valve repair or replacement may be necessary. Hormone-related diseases and low blood pressure. Hormones control blood pressure regulation, and imbalances can cause dangerous drops. Conditions like Addison's disease, hypothyroidism, and adrenal insufficiency disrupt cortisol, aldosterone, and thyroid hormone levels, leading to fatigue, weight loss, and dangerously low blood pressure. Can these hormone issues be fixed? Yes, take notes. Adrenal insufficiency treatment involves cortisol replacement therapy, which helps balance blood pressure. Thyroid hormone therapy is an option if hypothyroidism is the cause. Levothyroxine can correct the imbalance. Electrolyte balance is very important. Increasing sodium and potassium intake supports adrenal function. Stress management also plays a key role, since chronic stress depletes adrenal hormones, worsening hypotension. If hormone disorders go untreated, low blood pressure can become life-threatening. Can dehydration and electrolyte imbalances cause it? When the body loses too much fluid, blood volume decreases, leading to low blood pressure. Dehydration can be caused by excessive sweating, vomiting, diarrhea, or inadequate water intake. Electrolytes like sodium, potassium, and magnesium are also essential for maintaining blood pressure stability. If this is the cause, here is how you can fix it. Increase water intake. Aim for at least 8 to 10 glasses per day. Replenish electrolytes with coconut water, electrolyte drinks, or mineral-rich foods to help restore balance. Avoid excessive caffeine and alcohol, since both can lead to dehydration and blood pressure drops. IV fluids are the obvious option in severe cases. Hospital treatment with IV hydration is necessary, since oral intake might not be enough. Ignoring dehydration can lead to shock, organ failure, and even death. Can blood loss lower blood pressure? When the body loses a significant amount of blood, blood pressure plummets, causing shock and organ failure. Major causes include internal bleeding, severe injuries, heavy menstrual cycles, and gastrointestinal ulcers. But can this problem be fixed? Seek emergency medical attention, since severe blood loss requires immediate intervention. Blood transfusions are extremely important in critical cases. Donor blood is needed to restore volume. Iron and B-complex supplementation. If chronic blood loss is due to conditions like heavy menstruation or ulcers, supplements help replenish lost red blood cells. Monitor for hidden bleeding. This is critical since conditions like stomach ulcers or internal trauma may cause slow, unnoticed blood loss. Without treatment, severe blood loss can be fatal. How lack of nutrients cause low blood pressure. Key nutrients like iron, vitamin B12, and folate are essential for healthy blood and stable blood pressure. Deficiencies can lead to anemia, reducing the amount of oxygen delivered to the body, causing low energy, dizziness, and fainting. The best way to fix a lack of nutrients is improving the intake. Increase iron intake with foods like red meat, spinach, lentils, and high-quality supplements to help prevent iron deficiency anemia. Boost vitamin B12 and folate. These vitamins are found in eggs, dairy, leafy greens, and liver. These nutrients are critical for red blood cell production. And take supplements if needed. In severe cases, iron or B12 injections may be required. Without proper nutrition, chronic low blood pressure can lead to extreme fatigue and long-term complications. Severe infections and low pressure. Septic shock occurs when a severe infection overwhelms the body, causing dangerously low blood pressure. Bacteria release toxins that weaken blood vessels, leading to organ failure. Common infections that cause this include pneumonia, urinary tract infections also known as UTIs, meningitis, and abdominal infections. What do you need to fix this? Hospital treatment with IV fluids and antibiotics is essential. Oxygen therapy to support circulation, medications to stabilize blood pressure, and probiotics to prevent dysbiosis. Septic shock is a medical emergency. Without treatment, it can surely be fatal. Severe allergic reactions. A severe allergic reaction, also known as anaphylaxis, can cause sudden blood pressure drops, leading to shock, unconsciousness, and even death. The body releases histamines, which cause blood vessels to widen and pressure to crash. The most common allergens include peanuts, shellfish, dairy, eggs, bee stings, latex, and medications. To fix this you need medical support, including the use of epinephrine, or an EpiPen, injection immediately, seek emergency medical help as soon as possible, and antihistamines and steroids may be required after stabilization. Anaphylaxis is life-threatening and requires immediate action. In conclusion, low blood pressure may seem harmless, but as we've seen, it can signal deeper health concerns. Whether caused by pregnancy, heart conditions, hormone imbalances, dehydration, blood loss, nutrient deficiencies, severe infections, or allergic reactions, the impact can be profound, leading to dizziness, fainting, shock, and even life-threatening complications. Pregnancy-related hypotension is usually temporary, but careful hydration and dietary adjustments help manage symptoms. Heart and valve disorders require lifestyle changes, medications, or even surgical intervention. Hormonal conditions disrupt blood pressure regulation, making proper diagnosis and treatment essential. Dehydration and electrolyte imbalances can quickly deplete blood volume, requiring immediate rehydration and electrolyte replenishment. When blood loss is the culprit, whether from trauma, internal bleeding, or heavy menstruation, restoring blood volume through transfusions, iron and vitamin supplementation, and medical intervention is critical. Nutritional deficiencies, especially in iron, B12, and folate, contribute to chronic low blood pressure, making a well-balanced diet or supplementation vital. Severe infections like sepsis can dangerously lower blood pressure, necessitating emergency treatment with antibiotics, IV fluids, and oxygen therapy. Likewise, anaphylaxis from allergic reactions triggers a rapid drop in blood pressure, requiring immediate epinephrine administration and emergency care. Understanding the cause of hypotension is the first step to managing it. While some cases are temporary, others demand urgent medical attention. Recognizing symptoms early and addressing the underlying issue is key to maintaining stable blood pressure and preventing severe complications. Thank you for tuning in to Levitas. Please share today's video with friends and family, comment, give it a thumbs up, subscribe, and hit the bell icon to receive notifications for future videos. Your support is appreciated. It helps us grow and create more content to empower your health. Remain tuned to Levitas for more expert advice on your health and fitness journey. So, stay healthy, stay happy, and keep going.